All right. Welcome back, everybody, to another Future Focus, where we are continuing to navigate the intersection of business, technology, and the human experience. Today, we're going to be exploring on the business side how AI is changing the landscape of healthcare. And we're going to do both a broad and deep conversation into this. So I'm really looking forward to it. And to help navigate that conversation with me today, I'm joined by Kitty Kolding, who is the CEO of RAIsonance, or she's going to tell the story Renaissance if we want to get really fancy if you're trying to Google it. So Kitty, thank you so much for joining me.
It's my pleasure. Thanks for having me.
Yeah, well, I'm looking forward to it. So, for people who may not be, I always like to give a little bit of background into who I'm talking to and what you do. For those who may not be familiar with Kitty and what RAIsonance does, give me the backstory of you. I mean, because leading AI in healthcare, you don't just end up there. So, what was kind of that trajectory for you?
I've been running startups and tech companies and data companies, my whole career. I started my first company that was a data company when I was like 22 years old, and I've been totally addicted to startups and using technology to make things better ever since. This business there's a couple reasons, a couple of whys for me. Um, um, when we first started, a group of us, it was in March of 2020, and a group, COVID had just turned into the global nightmare that it continues to be. And a group of us were literally sitting around saying, is there anything we could do to help? Could we come up with something that would help? That was really, frankly, the impetus on this one. And I have the good fortune of being surrounded by brilliant people, technologists and data scientists, of which I am neither. I am neither of those things, but I love unlocking technology for good. How can we take this technology and make some stuff better, whether it's an internal thing or someone's life, or now in the healthcare world? So these AI experts that I was speaking with said, you can detect a signature in a cough. We could have people cough and figure out if they have COVID. And I was like,
Really?
How is that possible? And that kind of started my journey with this business. And we, I'll take you through the rest of it, but that's really where it started. And as I learned more about the potential of what this kind of technology can do and how much easier it could make people's lives, how much better, I was so compelled by the idea. And I started looking at what so many other people have done, such brilliant things in healthcare. And that by itself was so inspiring, like looking at other people's stories and what they've done. And I thought, oh man, we got to do this. We got to figure out how to get it done. But that's where, I came from. I just, that's my thing, is I like trying to figure out better solutions to problems that don't have to be as bad as they are.
So you're a technology problem solver in some ways. Is that a fair assessment? You like to take technology and say, I like to solve problems with it. Okay.
Yes.
So
exactly.
I'm actually, you're going to find I love to, I jump around a little bit because there's always interesting things people say that I want to jump in on. So you started your first technology company in your early 20s. Was technology, did you go into, because people don't just start companies. So that's interesting in and of itself, but a technology company, were you a tech head? Did you lean it? Because you also said, I'm neither a technical person. So that's really interesting.
I mean, I'm not a coder, right? Like I've never written a line of code in my life. And I'm by no means an AI expert. I've learned a hell of a lot about our technology and the way we do things, but you couldn't say I'm an AI expert. but the business that
So
I
you weren't
started was
in your high school years, you were not sitting in your basement coding C++ or in, DOS, doing all this other.
no,
That wasn't where you went, and then all of a sudden you went, you know what? I'm just not going to do this for someone else. I'm going to start my own tech company.
no. In fact, my mom has pictures of me when I was little, 5, 6 years old. I didn't play, you know, I didn't play doctor. I didn't play princess. I played office. So I would get the stapler and that's how dopey I am. Like that was the
Okay.
pictures that she would have of me. She used
Okay.
to tease me about
All
that.
right. In a little
Um,
pantsuit, you got the staplers and the
exactly,
notebooks and the cardboard box for the computer.
pencil
And it's
behind my
like, let's
ear.
go in and we're going to have a board meeting, kids, neighborhood kids, get
Exactly.
around. We're going to have a board meeting and discuss
Exactly right.
our local lemonade stand and how we're going to run that. I
Yep.
love it.
Yep. Yep. And my
Okay.
siblings will swear
Okay.
to that as well.
Okay.
Um, so that business though was at the time I was a commercial real estate appraiser, and I grew up in Chicago. And regular real estate, like if you're a residential real estate appraiser, you need comparables, right? So you need
Yeah.
sales of homes in this, right? And so the MLS is a great resource for that. It has a huge number of homes that have sold, and that's what you need. But at the time, this is a long time ago, in the commercial real estate business, there was no sort of MLS for commercial property. So warehouses,
Oh,
industrial
okay.
land, multifamily, shopping centers. There was
Which
no
made
kind
it
of
very difficult to know how to price things because obviously the
yeah,
MLS makes it easier to go, well, this is
yeah,
this size house in this
exactly,
neighborhood typically goes for this. So you know how to price and
exactly,
what's fair. Commercial was like, I, I don't
right.
know.
So the way that people would do it was in the Chicago area, there were roughly 7 counties. And so
Okay.
what would happen is all the real estate appraisers, which were typically, middle-aged white dudes, frankly, um, uh, we would all go to the assessor's offices once a week, and we would literally go through these pieces of paper that were nicknamed green sheets, but they were deed transfers. And you would literally write down the stuff from the piece of paper because you can't take it with you. And we didn't have camera phones at the time,
Oh
right?
yeah.
So a long time ago. And so you would write the stuff down and then you drive over to the next assessor's office and do the same thing. And after a few months of that, I was like, this is seriously the dumbest thing I've ever seen. Like, how can this be the way that we do this? I'm appraising 10, 20, $50 million
Oh
properties. I'm like,
yeah. I
really?
mean, commercial
Like,
real estate's not like, oh, these are like $10,000. You're talking multi-million-dollar deals. And you're like,
yeah, exactly.
multi-million dollars, and we're driving back and forth writing
And we're
things down
driving with the writing
on
on, yeah,
napkins to figure
yeah.
out whether or not this is a good price.
So I was like, I know, I'm going to hire a bunch of people and have them do this. And then we're going to put all this in a database and we're going to make it available to people. So that's what I did brainlessly. I was like, I'm sure I can do this better. And of course it was really hard, but I was undaunted because I was young.
Yeah.
And so then I was like, okay, so now I have these, huge piles of paper. And so my older brother, Mark, um, uh, he's the smartest person. He remains to this day the smartest person I've ever known.
Okay.
I was like, Mark, we need like a data, like, here's what I want to do. And he's like, absolutely, I can do this. So he built this righteous database and we had a computer. We had a compact, I think it was like a 286 or
Oh
something.
yeah. Like, and this
And
is back
so
in the day when like a computer was like $3,000 for just like,
yeah,
to
oh,
have one of
yes.
these things.
Yes,
They weren't
exactly.
cheap.
Yes.
And you had a compact or a
So he built
gateway.
a
This is like how it
database.
worked.
Right. And then we typed the things into the database and then we built this really cool database. And then because there was no sort of, internet readily available,
Yeah.
initially we literally published books. Like they were these big ass
Oh,
thick
legit books.
books. Yes. So I had people drive around to the places that sold take a picture so that you could actually see the building, because it makes a huge
Yeah.
difference. So anyway, that's what we did. And, you know, it was not a thing yet. And I was selling it to the very same people who were doing the driving to the to the assessor's office. I was like, doesn't it seem better? Like, wouldn't it be
Right. Wouldn't you
better?
rather have a big book? Wouldn't you just rather have a book where you can just turn to a
Yeah,
page and look at it
exactly.
and see what this is rather than spend your whole day driving around?
Yes, and they loved it. At first it was annoying, but I sort of got people's attention because I guess because I was young and I was a girl and my name was Kitty. So they would be like, what are you? Why are you standing in my office? So
You
I was
defy all the social stereotypes that we think of as
exactly.
we're doing this. So you're
Where
kind
is
of
your
almost a
sleeping fruit?
shock
Anyway,
factor.
Missy. Yeah. And so anyway, that's what I did. We ran that business for about 8 years. We had so much fun. It was really, really hard. Um, but it worked really well. We ended up doing all 7 counties in Chicago, and it ended up we sold it to a company in California that was doing something similar, and
Okay.
was rolling up companies across the country, and they themselves got rolled up, and it's still sort of alive today. The sort of parent is now a company called Comps Inc.
Okay.
And it's a real data source, but it was strictly because I was so annoyed by the way the way that it was working.
What I love though about that, what I love about that is it goes back to what I said earlier, where I said, so you strike me as a technical problem solver, which I can very much relate to, where you look at things
Yeah,
and you go, this is really stupid. Like,
right.
why are we doing this? There has to be a better way to do it
Right,
than this. And everybody else around you is going like, nah, that's just what you have to do. And you're going,
right,
come on, like, no way. This is
exactly.
dumb. You're telling me that this is the best we can come up with is this?
Right.
And you go out and go, you know what? Fine. Nobody else is interested. I'll do it then and I'll fix it.
Yeah. Yeah,
That,
and so, that was it, and honestly, after that, I was hooked because that thing where we use technology to solve a problem, it hadn't been done. It was better, we made it better. That was
yeah,
the thing. We made it better.
yeah.
And so, is it going to change the world? No, it didn't change the world, but it made things better for a
It
certain
changed the
segment of the
world for
world.
some people, though. That's the
Yeah.
thing. It did
Yeah.
change the world for some people because they went from driving to all these things or picking numbers out of the air to going, I have a book
Right.
that now I can look at that tells me all this stuff. And this is extremely convenient and saving me
Right.
time. People probably had dinner with their families now that they didn't have dinner before because
Yeah.
they didn't have to drive around. I mean, so legitimately, I think sometimes we forget, we think
Right.
the only things that change the world are these big, like, Googles
Right.
of the world, but it's like that legitimately solved a lot of people's real problems. That's hilarious.
Yeah.
That's absolute. I love it. I love the story. And I love the fact that female Kitty is the one that walks into the boys club and goes, hey, I got a better solution for you here. I love it. That's
And
fantastic.
I mean, I guess it was sort of disarming in a way, like they couldn't do their normal
Yeah.
sort of, man battle, or because I don't care. Like, that's not what
Yeah.
I'm doing
You
here,
beat your chest and go, no, we drive around and we go look at paper napkins and write this stuff down. That's what real men do. And it's like, yeah, I don't really care. It's
Exactly.
dumb.
Right.
And you can tell me it's dumb. You don't need to impress me with your bravado.
Right. Exactly. That
Okay.
that part I never, so that was a really interesting lesson for me too over the years. As I look
Okay.
back, and women in technology is not always the most sort of, um, it doesn't work the same for women as it does for men.
No,
Um,
no, it
and
does not.
so that that was very instructive for me, and it's been lifelong that I've been sort of observing my place in those things and trying to get it right. But anyway, that's sort of where it started. And after that, I
Yeah.
did, you know, a bunch of different kinds of tech or data businesses, and I had a load of fun. Honestly, I have had so much fun in my career, and
Okay.
but I I think I think that for most entrepreneurs, I have a feeling you're like this too. The first thing you want to do is, can I make something that someone wants,
Yep.
then do I have the timing right? Like, is now the right time for this thing? Am I too early? Am I
Right.
too late? Like, right. Is that, and then, the, uh, the grand slam home run is, can I do something that has an impact? I mean, a real
Yeah.
positive impact. Is it possible? So I
Yeah.
know so many entrepreneurs that look at things that way. And this business, when I really comprehended what we could do, it just checked all the boxes. And so, man, I'm a zealot now about this business and about the way that AI and technology can transform and make
In a
people's lives
positive
so
way.
much better.
Yeah.
So
Well,
much
and
better.
I want to transition into that, but I want to tie a bow on what you just said right there, because I think it's a really interesting perspective. And again, I don't think it's just for entrepreneurs. I think this is for professionals, for kids. I mean, I
Yeah,
think I've got 7
it's
kids
true.
and I think about, but it is that weird art and science of, it has to solve a real problem, but the timing has to be right. If you're too
Yeah,
early, people will just go, yeah, I'm not seeing it. And
yeah,
if you're too late,
yeah.
somebody's already taken care of it. And it's like, why would how is your mousetrap
Right,
better than the other 100 ones
right.
out
And then
there?
you're
And
wrestling
so,
over a tenth of a percentage point of market share, and
exactly,
that's no fun. Yeah,
exactly. But so it is that kind of component. And then again, that change piece where the home run is when it actually solves, it's more than just solving a problem. I mean, the sham wow solves a problem, but it's not changing the world, versus
exactly.
when you think about what you're talking about, which is what you're going to transition into now, is AI in healthcare fundamentally can change the fabric of
Yeah,
our health, which when you think about your health, if you don't have your health, you kind of don't really have anything else. And so being
right.
able to do that, and I happen to spend a good amount of time in value-based care, which is all about,
Mhm.
hey, instead of
Yep.
doing the traditional health model of let's wait till you get sick and then we'll
Yeah,
deal with you when you're sick. And I think that's where AI is opening a massive amount of opportunities.
yeah.
Is getting sick is all about patterns. It's all about going, when is
It's
the
really
rhythm
true.
off? And let's find when that rhythm's off, because that rhythm off means something. But before, there was no human way we could process that amount of data on a single
Right,
individual. There just was no way to, going back to, I think of your now, the
right.
analogy of how you started your first business, the amount of things going on with just one human being's body to try and know that, analyze it,
Yeah,
understand how it fits in the mix of everything. No human brain, no physician on the planet could possibly do it, nor would they even have
right,
access to the data to be able to do anything. And so you look at
right.
that and go, well, why didn't we do preventative healthcare before? And it's like, well, honestly, it wasn't really terribly viable unless you had a
Yeah,
total crazy person who literally tracked everything they did and came to their doctor like you did with this book and said, "Hey doctor, like here's everything. I just noticed my resting heart rate went up
uh-huh.
5 beats per minute last night." And the doctor goes, "Okay, like I don't." AI can go, "I know exactly what that is because I've seen 10
Yes,
bajillion other heart rates and I know what that
right.
pattern is."
Yep,
Okay. So you
yep,
identified this.
exactly.
So let's talk a little bit about your company specifically, because when we talk about how AI is changing healthcare, having worked at big companies like GE and doing a lot in the healthcare space, that can mean a lot. Healthcare is a big
Yeah,
ocean. So what part of the ocean are you swimming
and AI is a big ocean too,
in?
people use the term
True
AI.
enough. Yeah.
I mean, it's like there's so many dimensions of AI, like, um, and most people right now understandably think of AI as like ChatGPT, right? Like, this generative
Yeah.
AI
They're
and
like, "Yeah, no, I know what AI is. I use that GPT thing or whatever." You're like,
yeah,
"No,
exactly. Yeah.
That's
I mean,
not
that is
AI.
AI, but
It
there's
is
I'm just
AI,
saying
but it's
there's
also
so much. There's just
yes.
so much. And so that intersection of healthcare and AI is also super, super interesting. And I'm blown away every day by the things I see people doing. It's so inspiring. But our company, um, our ambition was to build a software only AI
Okay.
powered diagnostic platform that uses
Okay.
only a person's cough to get a diagnosis for a respiratory illness. Specifically, we started with COVID.
Okay.
We've since created a test for tuberculosis, and now we're working on
Wow.
influenza and RSV. And we want to. Our ambition is to have about 20 different tests on this platform over time.
Okay.
Um, so that you cough. The way you access our technology is a mobile app. So you cough into a mobile app.
Really?
Um,
Really? You're
yep.
using a
And
mobile app and you cough into your phone.
yep. And it takes your cough, it pushes it to the cloud where all our logic and compute and AI processing resides. And in about 2 minutes, it comes back and tells you positive or negative for whatever test you've selected. So that's in a nutshell what we're doing is we're taking that kind of diagnosis for a respiratory illness that could be dangerous for you or your kids or your mother or
Yeah.
whoever you may be caring for and putting it in your pocket. It's on your phone, it's fast, it's non-invasive, no swabs up your nose.
Yeah, you're not
Um,
shoving a stick up your
um,
nose or yeah.
yeah. And it's easy. It tells you if something didn't work right. So like with at-home tests today, you may have done something wrong and you'll never know because there's no
Right.
way for it to tell you, hey, that didn't work. And
Right.
so, we made sure that people would know if the cough didn't work, we immediately say, hey, you gotta do that again.
Okay.
Um,
So you're
and it's
allowing, and again, I'll break it down as I hear parts of this. So in addition to the test itself, which we'll unpack, but then you also have that feedback loop for folks, which is a critical piece that typically you don't get.
Yeah,
I mean, you think about a COVID test, you shove up your nose. If you don't go deep enough, or if you don't swirl it right, or whatever, it may say, nope, not right. And you would never know. You went, I did the thing. I
right,
think I did it, but you have no
right,
feedback. Where this is
right.
telling you, that
Yep.
wasn't an effective cough. You need to
Yeah.
do it again. Like, oh,
Yep.
okay, I'll do it again.
Exactly. Yeah. And right away, like in that moment, so that you don't sort of lose the chance that you've decided, no, I'm taking a test right now, and it sort of tells you
Right.
right away. Um, so, those things are all true. It's also, our ambition was, our tests are always available. It's on your phone. You don't have to go anywhere.
Yeah.
The tests are never out of stock. Our tests don't expire, right? We don't have any chemicals that expire.
Yeah. I mean, it's
It
good for
doesn't
the
create any
planet. You're
waste,
you're using
you know?
you're using an
Yeah,
existing ecosystem because people already have a phone, they
yep,
already have a device, they already have all this. You're not layering on something new that they have to do other than download, the app or whatever. But
right,
really, you're tethering into an existing ecosystem. And
right,
I mean,
right.
that's good from a sustainability standpoint as well.
Yeah, and we never get sort of caught in, supply chain interruptions are a huge problem, and
Yeah.
arguably, I think they're gonna continue, and so we never have that issue, right? Like, we're,
Okay.
truly pure software, um, and I think the thing that is really mind-blowing is we can process 20,000 tests per second. So, it just a yeah, just a
Wow.
stupid amount of, horsepower. Like, we spend a lot of time making sure that the actual part where we run the test is super efficient. And so the reason that that matters is because um, our cost to deliver a test, to process a
Yeah.
test, is based on server utilization, server cycles in the cloud,
Yep.
right? And
Yep.
so it costs about 25 cents for us. Like, our cost of goods sold in a business context is
Yeah.
about a quarter. So what that means is we can price our tests very affordably, still be profitable
Yeah.
to build grow the business. But equity has been really important to us from day one. If you think
Yeah.
about what we're doing, if you have a smartphone and an internet connection, you can get a proper test that um, that doesn't require a big health. You don't need to be at a big testing facility or at a clinic or
No.
have access to skilled workers or all the things that we saw when COVID early, when there was all the PCR testing and people lined up in cars. And I mean, you saw
Oh,
the
it was a
intensity of the
nightmare. It was a
infrastructure,
nightmare. It was
and it
just
was
an absolute
expensive.
infrastructure. It was
Yeah,
expensive and an infrastructure crusher. I mean,
yeah,
it just was like there aren't enough
yeah,
people on the planet to
right.
do this, which resulted in a lot of people going, "Forget it. I'm just not even gonna do it
Yeah,
then because I don't have time or money or resources to sit and
right,
deal with all this."
right. And then you think about people in faraway places where there is no public health infrastructure and there are no
Yeah.
testing facilities and vaccines are not available. Like, it's an enormous part of the planet. A large number of our fellow human beings are in a situation like that. But a lot of
Yeah.
people have smartphones. And so that was also for me so inspiring that we could create equity um, that was sustainable, that eco-friendly, fast. We spend real time thinking about what's the next pandemic, right? Like
Right. What's the
what
next thing? Because this isn't the
what's
last one we're ever gonna see.
no, unfortunately for all of us, it's not. And so we spend a lot of time getting ready for that, making sure that we can. It doesn't take very much for us to go capture a bunch of, I know it sounds weird, but coughs from people.
If
And
you
then
understand AI, it's to a normal person, you'd be like, "You go capture coughs." Like, it sounds bizarre. It really does. But it's
exactly.
one of those things that when you understand how AI works, it has to be trained on data. So you have to find people with the
Right,
condition. You have
right.
to capture their cough so it can identify the
Yep,
pattern in the cough so it can distinguish, this is
right.
exactly what that cough. Here are all the little data points that I can look for, and that
Yeah,
tells me that this cough is the right one. So yeah, you've got to
that's
capture it
exactly
from
right.
somewhere, and you need enough of it so that it can actually do it.
Right. And, with data science, more is 100% of the time better. So
Yep.
the more you capture, the better it is. And our products are under review right now with
Yeah.
FDA and with Health Canada, and we're going to be taking our tests to a lot of other places, especially our TB test for additional validation and approval. So, this is a long road. Each
Oh yeah.
time we develop a new test, we have to develop it and then
I
we have to
I
get it
worked in
approved.
pharma for
Yeah.
several years,
You
and I'm
you
familiar with the
know it really
regulatory
well.
process of going through this, and it's
Yeah.
not something, a lot of times people look at stuff and go, "Well, why can't we just get this medical stuff approved faster?" And it's like, well, there's a lot of red tape and a lot of
Yeah.
approval, and in many cases in good ways, because it's like, well, we wanna make
Yes.
sure it's
That's
it's
right.
valid,
You
that
have to
it's
be
safe,
careful.
and that it actually
Mhm.
works. We wanna make sure it's not giving so there's good reasons sometimes. There's
That's
plenty
right.
of bureaucracy in it, but again, I can only imagine the hoops that you have to jump through. Again,
Yeah.
especially if you're trying to pitch this to someone who's non-technical,
Right.
it can sound uncanny. I mean, it really can sound
So
ridiculous to
true.
say, so you're telling me that if I go, it's going to say you have like I
Exactly.
mean, even me just doing this on camera, for those of you who listen and don't watch, like when you think about it, it kind of sounds like,
Right. No, I
come
I
on,
will
like
tell
really?
you,
And it's like, oh no.
I talk to investors a lot, and something like, I don't know, maybe 15-20% of investors will be like, "Kitty, that is total bullshit. It's never gonna work. It's science fiction. That can't possibly be true." And I understand why people think it's science fiction because
Yes.
it does sound crazy. It really does.
Yeah, it
When
does.
we show people the enormous amount of data that a cough can provide, it's a super rich data source. And I'm really proud of the work that we've done, but we've barely scratched the surface. Like there is
Oh, I can
so much
imagine.
more we can do. And so, I agree with you. It is really, I know for me, for a long time, I was like, how can this possibly be real? And anyway, it's just been wonderful to learn and push the edges and see, um, first of all, the consistency. Like there are these patterns. You had it exactly right. There are patterns that we teach our models to look for. That's in essence what's going
Yep.
on. And there's a distinct pattern for COVID. There's one for TB. There's one for all these
Yep.
diseases. We think we can, over time, get to things like pneumonia and various kinds of lung cancer. And, we won't do things like that. Like we think there's some tests that are appropriate for like an app on your phone and over the counter kind of a solution.
Yeah.
And there's some that are appropriate for point of care, meaning physician originated and sort of
Right, but you
managed,
still
right?
would. I can see a world where, and again, this goes back to oh man, I should have booked this for like 4 hours because we could literally just plumb the depths of this. But I can see where even in your business, the critical thinking that has to go into, because to your point, are there some things that make perfect sense for you to do as a consumer on demand,
Right,
cough into your phone, and
right,
you go, "Look, I'm trying to decide whether I'm going to go to this kids meetup thing because I don't
right,
feel the best. I don't really want to go get the whole neighborhood sick," type of thing.
right.
Great. Lung cancer, you probably
Yeah,
don't want to find out you got
no,
lung cancer on an
that's not
app and
the
you go,
thing.
"Oh my
Uh-uh,
gosh," because there's a
exactly.
whole emotional,
Yes,
psychological, like, what do I do about this? Like all these
that's
other
right.
things that you go, but that still adds tremendous value because in the physician's hands, instead of them having to go, okay, you might have lung cancer, and this hits a little closer to home than I'd like, but the whole like waiting period of, well, we got to wait weeks. So we got to do this and we got to run this test and this test
Yeah.
and this test. And those are all weeks that someone is losing sleep
Yes, yes, exactly,
going, I don't know, like, is this it? How,
exactly.
whatever, versus if a physician can be there to psychologically support someone and in seconds or minutes say, all right, the results are in. We at
Right.
least know. So now we can talk about what we're going to do about
Mhm,
this. But you
mhm.
don't want somebody doing that in their house. You want somebody
No,
doing that
that's
at the
right.
point of care. But the technology still adds equivalent value. It's just a matter of whose hands it's in.
Yeah. And we like, to me, there's not a lot of tuberculosis in this country, thank goodness. Uh, and we're all Americans, people in North America, we're very fortunate as a result. But tuberculosis is a terrible disease, and that's our newest test that we're just submitting to FDA for review right now. But you know, the story of TB is that, first of all, there's an amazing global community of organizations, NGOs, governments, researchers, hospitals, universities that have been working together for decades to try to get their arms around and defeat TB. But the story is that, like, I didn't know this till we started working on TB. TB is the number one killer of women from ages 15 to 44. And
That
it,
that is crazy when you think about that, because I think
yeah,
so often we live in our fish bowls of, and I've got a pretty global audience. And I even think back to a comment you made earlier about, the whole vaccine thing. And I know someone who went globally to another country and they were talking about some of the politicization of vaccines here. And the person over there was like, wait, you mean you have
right,
people who have access to it and they
right,
don't like their
exactly,
mind was just, they didn't even have a category for it
right,
in terms of that. And so I think sometimes we're in our fish bowls and we don't
yeah,
realize that it's like this stuff that we may take for granted over here and go, tuberculosis, like, is that even really a big thing? Like, that's crazy that that's the number one killer of women in that age bracket.
yeah, and and it's also a terrible killer for kids because so what we learned was that, so in certain parts of the world where TB is endemic and is kind of ever present, um, it might cost you a month's salary to get on a bus and make the journey to the TB clinic to get your test, right? And so you manage to do this, and maybe you're a woman and you bring your child with you, and
Yeah,
you've certainly given it to each other. Like, you're both infected. You
for
can't
sure.
raise a
But now
child and
now you've infected all these other
yeah,
people.
now you're on a bus, and then you have to wait in line at this clinic, right? I'm sure everyone's infecting each other, but forget about all of that. So if you get there and your turn comes and goes, and the doors close at 5, and in a lot of places those doors close, like they don't stay open, like you're done. You have to leave, and come back some other time. But even if you get in, um, typically the way that TB diagnosis is created, it's a complex thing to diagnose. So sometimes in this country, we do a skin test, a PPD
Yep.
test. They inject this
Yep.
stuff and see if there's a reaction. Some places do a PCR test for TB. Frequently, there's imaging. They want to take a look
Yep.
at your lungs and see if there's an infection. And then they want to do a sputum culture. So you've got to get a sputum sample, which is not super simple and is almost
No.
impossible to get for little kids. It's really, really hard. So
Okay.
with little kids, you can't get a sputum sample. So they do a heel stick, and it's really painful for these little guys. And so, but anyway, that sputum culture could take 2 months to grow, right? Like, there are so many hurdles, so many inputs to getting a diagnosis. And I am not saying that our test is better than any of those. That's not what I'm saying. What
No,
I'm
that's not the
saying
point.
is that what we can do, the contribution we can make, is at the front end is getting that we're positioning our TB test as a screener, because
Yeah.
it's only part of the equation, right? And so
Yes.
you can cough, you can get that result. And what's the first thing that happens after, if you were my doctor and you gave me the test and I came through positive, you'd be like, oh, wow, we need to get you into treatment, get you through the rest of the diagnostic process. And the very next thing you want from me is, please give me a list of all the people you live with, that you work with,
And it's
that you
been
write.
2
Because
months.
yeah, those people have been,
Exposed.
exposed, and they should be tested. And so one of the things that I love so much about what our team came up with was, you can collect a list of those people and send all of those people, either using email or a text message, a test that says, you've been exposed to TB. Please click this link and cough. And in 2 minutes, we'll know if they're positive, right? Like, the kind of change that this kind of a solution is able to deliver is just your point about, like, we're so fortunate in so many ways in this country, and it's not like that for a lot of people
No,
in the world.
it's not. It's not. And I mean, yeah, the equity piece is huge in and of itself. But even for folks who maybe can't relate to that equity piece, even what you just described is something that we all can at least relate to, of the headache of,
Yeah,
like we said, like having to even schedule a doctor's appointment and having to go in to
right,
this, and then you get sent to a testing facility. And one of the things I am extremely
right.
keenly aware of, especially in the US, is how inefficient and cost ineffective our healthcare system is. I mean, it's just so
Yeah,
bloated with so much stuff that, going back to, I think back to your very early story of going around and getting all these things and writing stuff on the back of a napkin. There's so much stuff in our healthcare system that we've just accepted as,
yeah,
that's just the way you have to do it. And it's
yeah,
like, wait, what? No, it
right.
isn't. There's a
Doesn't
better
have to
way
work
to
like
do
that.
it. And
Yeah.
it doesn't have to be that way. It doesn't have to be a terrible, expensive,
Right.
unequitable experience to people.
Yeah,
We can actually do this and radically change the future of healthcare using technology.
yeah. And, the scalability, the easily, we move tests around using email and text messages. We don't have to ship anything anywhere, right? Like, there's no
Yeah.
logistics, there's no warehousing, and that's a real cost. Like, that's a huge percentage of some of those costs that nations, low and middle income countries have to accept. And another thing that, this kind of technology, and believe me, there's a lot of people doing really cool stuff along
Yeah.
these lines that, it's going to change. The world is going to, 10 years from now, we won't have to drill holes in people to get information about them, right?
Yeah.
We won't need wet samples, and we won't need there's so many wonderful things happening that this is one of 1,000 wonderful solutions out there.
Yeah. Well, and what's interesting about this, and I'm actually curious, because again, this is where I have spent so much time around artificial intelligence, even before it was cool in 2023. And, but 2023 really brought it into the spotlight.
Yeah.
And one
Yeah.
of the things that's been interesting about it is I find a lot of people on either two polar ends of one spectrum. One is like, this is going to be the end of the world, and we're going to be buried in a bunker, hiding out from the Terminator type of a thing.
Right.
Or, it's just like,
Right.
it's going to be the end of all jobs. And then I have folks on the other end of the spectrum that go, it's a fad. And on both ends,
Right.
I'm like, it's neither of those. And I think what we've talked about
Right.
here has highlighted that there is some incredibly amazing things that we're going to be able to do with this. But I am curious on your end, as you do this, what has the response been from people? Because one of the things that I think is even interesting as I unpack some of the things in my head that you've been talking about is AI ripped the face off a lot of things that we just assumed to be true before. And it was a little bit disturbing for a lot of people. When all of a sudden they went, well, I've built my whole career on, a family physician. Kids bring their kids and they cough, and I do this. And so these kinds of things suddenly go like, you're telling me an app is going to replace me? And it leads to, in my opinion, unnecessary resistance because people haven't
Yeah.
recognized they've intertwined their personal identity into these activities. And I think we've done a good job of saying, like, well, this doesn't get rid of the need for a family physician. It just changes
Oh, no.
radically the way
No.
you interact with it. But I have to imagine, you talked about some of the investors. I have to imagine you've run into some of that along the way.
We do. Yeah, we do. And some of it is just sort of baseline disbelief that about technology in general. But um, physicians, I think rightly, are among the most skeptical until we show them sort of how it works and what the data shows. And there's some really compelling images that we can provide that tend to make them, willing to listen further. But I think I have seen a change in the past 3 years, especially with healthcare professionals,
Okay.
because their experience, I think, has been so tough since COVID. I think
That makes
they
sense.
are burned out. Many of them, have long COVID, and that's why they've exited, the practice of medicine. And it's just been really, really tough for them and lots of other people too. And
Yeah.
what we try to talk about is, look, this is another data point. It's fast. It's easy to use. It's not hard for your patient, doesn't hurt your patient. Your patient can do it at home and you can see the result. Like, it's another data point that should help. And I think that initial skepticism has been, in some ways, has been kind of balanced out by the need, because we're
Okay.
all seeing, this time of year, we have this winter, COVID, flu, RSV. Now we've got this mycoplasma pneumonia that, people are getting, and there's a lot of worry about. And I mean, it's just so much that at this point now, I think providers are starting to be like, you know what, if you can give me something that helps, that is easy for me to manage, that doesn't, like, sure, let me take a look at it, But I think the
Okay.
thing that we've seen that has been the most exciting is we think of part of our business being diagnostic. What do you have? And
Okay.
so then a doctor can make a decision about how to treat you. But we think that there's this really interesting ongoing care component. You talked about it a minute ago, value-based pricing and how all that works. So a scenario where they put you're in good shape and you get discharged and you're at home. And the number one thing that everybody wants to avoid is you getting readmitted. And
Yep.
there's a bunch of reasons for that, both economic and care for the patient related. And so if you could, everybody knows you had congestive heart failure, but if you could cough once a day or twice a day, and we could send you a result to your physician, and we can look for subtle changes that may be predictors of you starting to wobble, something's, and then that
Yeah.
physician can intervene faster and get you on some more antibiotics, give you some new treatment that keeps you from really falling down into a bad spot and keeps
Yep.
you out of the hospital. Nobody wants you back in the hospital, including you. That's kind of the care version of this that we have also developed. We built these wellness products. That's what they do, is they look for tiny little changes in your respiratory system. And
Yep.
for people with cystic fibrosis or COPD or asthma, if we can help them see that they're starting to get near an exacerbation, they're starting to, have a problem, and size it, understand, is it a big problem or is it a little problem? Is it at the
Yeah.
beginning or is it kind of far along? My mom died of pulmonary fibrosis, and she lived with us the last few years of her life. And I would take her to see her pulmonologist regularly, and it was really tough for her. She was on oxygen and she was in a wheelchair. It was really exhausting. And if I could have had this when she was still alive, where she could cough
Yeah.
from home and I could send that to her doctor and he could look at the data. We talk to pulmonologists all the time that are like, some of the tools that we have, they're useful, but they just don't tell us enough, And
Yeah.
so the amount of data that we're able to deliver, and this is purely about AI and compute power, what you were talking about before, and this idea of being able to see in 2 minutes how somebody's doing and manage their care. And yes, you need to come in. No, you don't need to come in. You're okay. Like just little things like that. That's
Yeah.
the other side of this coin is being able to manage yourself. We've seen some fascinating data from our own technology about the impact of poor outdoor air quality, like wildfires.
Mm.
And we can
Yeah.
detect these meaningful changes, even if you've only been out in a wildfire zone for a day. And so that's the kind of stuff that,
Yeah.
I just think there's so much more to be. That's what I mean about scratching the surface. There's so much more to be
Well,
done.
and that's the thing that's really fascinating on this is, we talk about like how far AI has come, and when I look at it, I go, we haven't even chipped the
Yeah,
surface on most of this
right.
stuff, because it's fascinating to me how much we think we know about things. The AI is showing us you actually really don't know anything about this.
Yeah.
Because it's able to look at so much more data at a speed and pace that no human being ever could.
Yeah,
And so I just even think the discovery that
right.
someone's cough is so distinct and unique, and there are these biomarkers in a cough that
Mhm.
are indicative
Mhm.
of, hey, when people cough like this, it's because they have this, that even the human ear wouldn't even be able to pick up, because the distinction
Yeah.
just isn't, it's not
Yeah.
even possible. And even if it was, the one doctor only hears so many coughs. They're not going to be exposed to
Exactly.
millions and trillions of coughs to even be able to go, well,
Exactly.
maybe there is a pattern, but I wouldn't have heard enough coughs to be able to pick up on the
Right.
pattern to be able to do anything, type of a thing.
Right. Yeah. I mean, think of, this country, we fortunately don't have very much TB here. But if you're unlucky enough to get TB, there are not a lot of physicians in this country that have had experience with TB patients, and
Yeah.
they wouldn't necessarily audibly they have very, very practiced ears, but they may never have heard a live TB cough, So
Yep.
Yeah, your point is exactly right.
Yeah. Well, and I think that's one of the things going back to even, value-based care and how do we focus on health differently. There's two things that come to mind. I'd love your kind of reaction to this. But like one of them is, so I think of my Apple Watch. My Apple Watch is better at predicting my health than I would have ever imagined because it's tracking my heart
It's
rate, my
remarkable.
breaths per minute. It's tracking all these
Yep.
different data points and it can look at the data
Yeah.
and it can say, hey, like,
Yeah.
hey, just FYI, your resting heart rate had an unusual spike. And I
Yep.
know, well, when I see that, it means I'm probably about to get sick. And if I can
Yep.
slow down my workout regime, maybe get some extra sleep, I might be able to mitigate
Yep.
how bad I get sick
Exactly.
by doing this. And I have a faster
Right.
recovery. Life gets back to normal more. And it's one of those things that I understand where sometimes people are concerned about, well, and they're legitimate. Well, what about all this data and what is all being done with it? And how do we figure
Yeah.
all this out? But it is this kind of balancing act of, yes, but what are you missing out on by not leveraging some of this stuff,
Yeah.
by being afraid of well, what
Yeah.
if? It's like, yeah, but what if you could have
Yes.
detected a disease that was going to take you out and gone and got treatment before it actually ended up killing you? What if you caught the cancer that you didn't really want to take a test because you were like, I don't know, I just don't really want to
Right.
go in, and you're able to do it and catch it when it's still in a treatable state before it gets to stage 4 and it's like, well, you got 6 months to live type of a thing. These kinds of things are real trade-offs
That's
that
right.
technology is radically changing what we can do.
That's right. Yeah,
So
the
the other one, oh, go for
AI
it.
in
Go for it.
imaging. I was just gonna say, I was at a conference recently and I spoke with this brilliant guy who's he's South Korean and he has this incredible AI technology in the imaging space. And um, he was showing like they have he like side by side showed an X-ray, and then he showed an X-ray with his technology, and it layers the different parts of the infection that was in the lung. It was a TB
Okay.
case in that case, but I mean, it is shocking how much better some of that technology is than and you know uh, radiologists are brilliant and they see things no normal person would ever see in an X-ray image, right? But
Yeah.
this is something completely different. It's just a whole
Yeah.
other it's order of magnitude different.
Well, and going back to the change side of it, you know, I am sensitive to the fact that for a lot of people this is extremely disruptive. And I get that because maybe,
Mhm.
whether and I did a lot in the radiology space. It was extremely disruptive to a radiologist who's built their whole career looking at scans, trying to detect this to suddenly be told, you know what, we have an algorithm that is 10x more accurate and faster at detecting this disease type of thing. On the surface that can sound like, wait, what? And I think of even the cough thing, the
Mhm.
doctor who's gotten really good at
Yeah.
being able to do this can sound like, well, this is really concerning to me about what does this mean for my future. But when I think about what I'm watching as AI's continuing to rise, is the fact that what it's doing is making the things that are distinctly human about us that much more important. And what's interesting about it in the healthcare space is I think about how when I worked with physicians on this, how it was like, yes, but do you really want to be known as like the scan guy or gal? Like, is that really the value that you want to
Right.
add? Or is it you are really good at helping people understand what this means and what we can do about it and where we go from here? Like,
Right.
don't you really want, isn't the value you add more about the relational component and the problem solving and the creative? Isn't that really what gets you out of bed? Like, do you really get out of bed to go, I can't wait to stare at x-ray scan? No, you don't.
Right. And
And once
treatment,
people start to
right?
real
Like,
exactly, like you got into
brilliant
medicine because
doctors.
you wanted to make people better.
Right, and brilliant doctors, if you could make that reading of X-rays, or some other kind of diagnosis it's not that you're a diagnostician, it's that you're a physician and you can treat a patient. Now you have more information. Now you can
Yes.
move to treatment faster and perhaps more confidently. And you can maybe monitor that person's treatment far more with way more granularity than perhaps you were able to before, because this technology is telling you things you haven't necessarily seen before about the treatment that you chose. Like I just
Right.
I know just what you mean. And the best physicians, it's not so much that they're diagnosticians, it's that they treat patients and they get wonderful outcomes because of their treatment.
Yeah. And that's, again, the distinctive factor that what I found is when people can start to see that their value isn't inherently tied to the tasks, the robotic
Right.
and mechanical
Yes.
tasks that
Yeah.
we often spend so much time of our days doing. We spend so
Yes.
much time just doing these robotic, I've got to do this thing, I've got to do
Yep.
that thing. And it's not
Exactly.
adding real value to ourselves or other people. And AI is actually allowing us to say, hey, didn't you get into medicine to spend more time curing people and
Right.
changing people's lives? Suddenly it goes, well, yeah, well, now by doing this, all the time you used to spend running these
Yeah.
tests, waiting on all this other stuff, now you can put that to the side and it isn't
Yeah.
taking from you. It's actually adding to you because now that time you used to waste on that can be spent on these real human valuable activities that are transformational in nature.
Right. Yes.
Interesting. So you've been doing this
Yep.
for how long has the company been going? Oh, I
So
might have cut
March
out.
of 2020
How
is
long
when
have
we
you been
started.
doing it?
So we're coming up on 4 years.
Okay. Okay. So 4
We
years
started
you've
in
been
March
doing
of
this.
20, and so almost 4 years. Yeah.
Okay. Okay. And you have how many tests now? And you said you're working towards getting to 20, right? That's if I understood you correctly?
Mhm. Yep. So we have tests for COVID and tuberculosis under regulatory review, so they're not available yet.
Okay.
And today we're working on our newest clinical trial is our generation 2 COVID test, and then RSV and influenza. So our hope is that by mid to late next year, we will have all 4 of those available for use. And yeah,
Okay.
you're right. We want to get to, we think there's about 20 that we can get to in a reasonable period of time.
That's so we're looking at tuberculosis, COVID, 2 gens of COVID, and the flu, right? Were those the big 4?
And RSV. And
Oh, and
RSV.
RSV. Okay, which that one's another one of those ones where I've got 7 kids, and I remember one getting RSV really bad, and it was an absolute nightmare,
Yeah.
and I just think of how
Yes.
I remember how much of a pain it was to have to even try and get to a point where you could get a diagnosis so that you could get the
Yeah.
nebulizer, to get the nebulizing spray, to do, you know, this doesn't eliminate all that other stuff, but what it does is compresses the time frame by which you can get involved and actually start working on the actual treatment
Yes.
of the disease, which is awesome.
Yes.
Okay.
Yeah. I have 2 kids myself, and they invariably get sick at 3 in the morning. Right. That's sort of the time when you're always like, it's 3 in the morning. What does my child have? How am I gonna manage this? So yeah, we think like we want to get to pertussis, right? Like that would be pretty handy to have in an app. And there's a long list of understanding the difference. What you see a lot of times is people that have pneumonia. Sometimes they physicians or other folks assume they have bronchitis, but
Mm,
those are very different things. But they can sound or look the same, right? And so again,
okay.
being able to distinguish between bronchitis and pneumonia, or even just imagine bigger picture, being able to distinguish between a bacterial infection and a viral infection. If you don't
Yeah.
have to give somebody antibiotics, we all know how this antibiotic resistance is starting to really mess with us in a million different ways.
Yep.
That
Yeah.
antibiotic stewardship is super important.
Yeah. Well, and in addition to the antibiotic crisis that we're facing, even when I think about medical triage and how, a lot of times we take our best
Yeah,
stab at something, we have
yeah,
to wait to see if that runs its course first, and
right,
then we can move on to option
right.
2 because you can't do them both at the same time. So not only is this improving the possibilities of what may happen with antibiotics, but the fact that you could, instead of wasting that precious
Yeah,
time and somebody suffering through 2 extra weeks of something to see, well, did we cure it? Oh, we didn't. Well, then I guess maybe it's
right.
virus related. Now we'll do something different. It's like we can do
Yep,
smarter, more precise precision medicine
yeah,
versus, well, we'll throw spaghetti at the wall,
right.
hope some of it sticks, and
Yeah,
just deal with the consequences, which goes back to the theme of the whole conversation
yeah.
we've had is there's a better way. There's a better way to do
Yes,
this. And why would
right,
we not want to push this forward?
right.
Okay. Okay. Well, Kitty, this has been a phenomenal discussion. I have thoroughly enjoyed our hour together. And I really appreciate just hearing, like you said, the world of AI is a huge ocean, the world of healthcare is a huge ocean. But even hearing this, I think, is a huge encouragement for anybody watching or listening of, hey, this is yet just one incredible area, AI used right. And to me, that's the
Yeah,
key is we need to make sure we
yes.
use it right,
That's
but
right.
when we use it right, the benefits are incredible.
Yeah. Yeah, thank you so much. It's such a pleasure to talk with you, and I appreciate you giving me an opportunity to talk about our story a little bit.
Yeah. Yeah. Well, thank you so much, Kitty. Thanks for joining me. Thanks, everybody who ends up watching and listening. And yeah, definitely something as a parent, and someone who's just health conscious in general, I will definitely be following and checking out as, because
Great.
boy, the thought of just having my kids cough in the phone and know whether I need to do something is pretty
Yeah.
sweet versus having to call a pediatrician, find out when they're open, having to do all this other stuff. And then half the time you're like, oh, never mind. I'm not even going to bother doing it.
Right.
Cool.
Yeah. Well, thank
Well,
you. Thank you so much.
all right. Well, thank you, Kitty. Thanks everybody for watching and listening. And I hope you all have a wonderful, wonderful rest of your week. And we will see you on the other side.